Good afternoon, everyone. Paul Marseille here, former CPA president, and welcome to the new presentation, Experiential Democracy Dialogue #2. I have the honor of introducing our presenter for this afternoon, Dr. Kurt Schneider, who is a licensed psychologist and a leading spokesperson for contemporary existential humanistic psychology. Dr. Schneider is the current president of the Existential Humanistic Institute, a council member of the American Psychological Association, and past president of the Society for Humanistic Psychology of the APA, and recent past editor of the Journal of Humanistic Psychology, and adjunct faculty member at Saybrook University and Teachers College, Columbia University. Kirk has published over 200 articles, interviews, and chapters, and has authored over and edited over 13 books, including The Polarized Mind, Existential Humanistic Therapy, and The Spirituality of Awe, Challenges to the Robotic Revolution. Kirk is going to share his work with Better Angels, an organization that seeks to encourage meaningful conversations between people who might have starkly polarized opinions. And I've agreed to be part of this exercise along with Dr. Michael Donner. So now I'll turn things over to Dr. Schneider.
Thanks so much, Paul. And I'm very honored to be before you here and be asked to give this address and this demonstration. Thank you, Joe and Cindy and Robert, Natasha, all who have been involved in organizing this. It's been a wonderful webinar thus far, despite major or notable technical issues, but still great. So welcome to this journey into experiential democracy, deep democracy, which is the attempt to address the whole human being as opposed to just a label or stereotype about the human being. And I really liked Steve Hayes' phrase just earlier, the idea of achieving bigger habits. This is about achieving bigger, more holistic habits, if you will. So the first thing that strikes me about difficult conversations, be they about race or politics or religion, is how quickly they devolve. And they tend to devolve into three basic areas. One is verbal flamethrower, which I'm sure most of you, maybe all of you, have experienced, probably recently. I certainly have. A second area is complete avoidance, where you just simply don't talk about the charged issue. And again, I'm sure we can all relate to this, and maybe in our families and communities, with friends. And the third, and the most obviously painful, is violence. And certainly recent events at the Capitol and in the streets magnify these issues. So I've been asking myself about what causes such inflamed reactions, part of us all, and the speed with which these kinds of conversations devolve, and what steps can we take to address these vicious cycles? So these really were the impetuses for writing my recent books, The Polarized Mind, and the most recent one, The Depolarizing. In The Polarized Mind, I was trying to address the mindset that seems to lead to this kind of devolution conversation. And in The Depolarizing of America, I'm attempting to provide skills to address the problem. And in any case, this is basically what I learned from these works. First of all, I view the polarized mind as the fixation on a single point of view to the utter exclusion of competing points of view. And I see this problem, this scourge of humanity, as perhaps causing more human destructiveness throughout history than just about any other mindset that we've evolved or devolved. I see it as very major, and you can see signs of it from the earliest writings in Babylonian myths about overreaching and an attempt to achieve immortality, or the Greeks talking about hubris, prideful overreaching, and nemesis, backlash against that. And right up to our own times, obviously, and the divisiveness that we see. I want to emphasize that the polarized mind operates both at the level of the verbal and the nonverbal, or the pre-verbal, kinesthetic, the embodied. And that's a very important aspect of this. It's not just about the words we exchange, it's also about the tone that we exude in our conversations, how we say the things we say, and what kind of energy we're conveying. So this is how it gets to a deeper, more experiential form, as I'll be describing momentarily. Now, I'm going to be applying this experiential democracy dialogue, which, as Paul mentioned before, derives from my experience as a trained moderator with Braver Angels, which I'll talk about momentarily, and my own work on this form of dialogue for the last 17 years or so. But I generally apply experiential democracy dialogue in webinars with a number of groups to people with very charged political and cultural differences. But I've been feeling more and more, and I think a number of people resonate to this, and certainly as psychologists, therapists, you can resonate, that we have this problem in our own house, in our own field. Great polarization among a number of areas in psychology that are embattled with each other, and so I thought this would be a great opportunity on a kind of maiden voyage to apply the dialogue format to what are typically seen as very polarized points of view. Paul Marcil is going to represent cognitive behavioral perspective, Michael Donner, the psychodynamic psychoanalytic perspective in this dialogue. Both are very esteemed colleagues in these areas, and I'm very appreciative that they're going to participate in this journey with us. And what I'd like you as the audience to do, to the degree possible, is to put yourselves in Michael and Paul's shoes, wherever it seems to resonate most with you. And by the way, it doesn't mean that you have to naturally be cognitive behaviorally oriented or psychodynamically oriented. Sometimes, as you know, it's very helpful, especially as therapists, to try to reach across the chasm and experience what it might be like to be in the shoes of that person who is generally very, very contrasting from you. So that can be helpful just as well. I'd like you to go through this journey with us, to the degree possible, make it experiential in that sense as well. So we wanted to give you a couple of examples of how these kinds of conversations within our own field can devolve so quickly. So here's just a couple of statements that you've probably heard in halls of academia, or maybe at APA conferences, hope not at CPA conferences. Here's a couple of examples, just to give you more of a feel. So here's person A. Oh, so you're one of those cold, hard cognitive behaviorists. You work like a computer and you treat people like machines. Here's person B from the other side. Oh, you're just an anti-science Freudian. your work is passé. And there is not one shred of hard evidence to back up your imaginary ideas, the unconscious and dream interpretation. Now just pause for a moment and think about all the stereotypes and belittlements of these two very short statements. Think how you would feel if these statements were thrown at you, or even if somebody's in the mode of thinking that way, how you would feel as a flesh and blood human being, but also how much you would feel that your perspective is belittled, reduced, distorted. Phrases such as cold, hard, cognitive behaviors. You're like a computer. Treat people like machines. Or on the other hand, you're anti-science. Your work is passé, old-fashioned. Not one shred of evidence for what you're talking about. Seems to me these epithets, these very knee-jerk phrases can be horribly debilitating and destructive, obviously. So in my research and experience, the chief basis for the polarized mind is fear. And in particular, the fear of insignificance, not counting. We have quite a bit of evidence to back this up from especially an evolving part of social psychology called terror management theory, which equates the fear of insignificance, not counting, of being invisible, with death anxiety. So I think it's worth contemplating how death anxiety may overshadow many of the ways that drive us into very fixated, singular mindset. Put it frankly, we're afraid of dying, afraid of being killed, annihilated, at a very existential based level. We're afraid of identity death, which can be very similar to some of our fears about physical death, and a kind of groundlessness end up with, where we have no moorings anymore. Many of you know this can be horrifying for all of us, but especially when we're really traumatized. So this webinar provides one time-tested way to help people address these fears that fuel the polarized mind and that lead to the vicious cycle. I call it the Experiential Democracy Dialogue. Again, this format, the Experiential Democracy Dialogue, derives from my work as a trained moderator with Braver Angels, which is a grassroots citizens movement. By the way, it's Braver Angels now. It was Better Angels earlier on. Had to change their name. It's a grassroots citizens movement that started at the time of Donald Trump's election about 4 or 5 years ago, when it was clear to one of the co-founders, Bill Doherty, a psychologist at the University of Minnesota, felt very strongly, along with a number of us, that we have important skills that we can bring to bear from our psychological training to the social arena to address this divisiveness. Braver Angels brings self-identified liberals and conservatives together for living room style dialogues, and they tend to be highly supportive and highly structured. And if there's one thing we've learned about conflict mediation over the years, is that those two pieces are extremely important. Again, these dialogues can go off the rails very quickly, and if there aren't guardrails, like a creation of a sense of relative safety, ground rules, which we'll go into momentarily, and a very good structure to them, they can unravel very, very rapidly. So the Experiential Democracy Dialogue is a hybrid of a training experience with Braver Angels, and as I say, what I've been developing since 2002. And I started Experiential Democracy Dialogue, which, by the way, is a one-on-one dialogue, whereas Braver Angels does have some one-on-one formats, but it's mainly group process oriented. I find the two to be very complementary of each other. I think both the intimate one-on-one can be a very important complement to group process, and likewise, and also a follow-up to the group process, and likewise. So mine was sparked at the time of the Iraq War and great divisiveness and reactivity at that point that I felt deeply I needed to address. Okay, so now I want to get to our slides here, and as you can see, we're really trying to come from a place of curiosity, respect, and openness. This is the credo of Braver Angels. And I just want to home in on that term respect. If you can't find yourself really respecting the point of view or the contents necessarily of the other's perspective, at the very least, we encourage respecting the fact that they have cleared the time present to you and to sit with you and be in dialogue. Okay, so here's ground rules, extremely important. These really anchor the whole process. They basically revolve around curiosity. Now, I know that Dara talked about that concept, that sensibility earlier, and I really liked her notion of even being able to go beyond curiosity to very intensive interest as well. But I think that curiosity is a great first step. Not everybody can have that strong interest necessarily going into these right away, but certainly optimal if one can find that in oneself. So basically, as you can see, the ground rules here are pretty straightforward. Content-wise, you don't want to be interrupting the other person. You really want to give them leeway and attempt to create a kind of sacred space, if you will, each person. And the nonverbals, very important. No rolling of the eyes, big sighs, or, furrowed brows, if you can avoid that. You try to bring your best self to the dialogue, and certainly we have training in that area. Trying to bring our most centered and mindful selves, if you will, present selves. Mindfulness and presence are very important aspect to this process, especially experiential aspect of experiential democracy. Okay, so generally we go into the setup phase from there, which we don't need to do now, but I wanted you all to see how this is generally done in webinars and with people with cultural and political conflicts as well. So this is a point where we ask people to choose the political position they'll take, liberal, conservative, and the topic take. Obviously, we have the topic set today, cognitive behavioral and psychoanalytic therapy. Okay, first phase is visualizing the dialogue. This is where we have Paul and Michael just visualize what it might be like to be in dialogue with one another before even going into dialogue. This kind of priming we find very helpful. It's a part of getting centered. It's a part of opening to the fuller person beyond the label or the reactivity that you have toward them. So we encourage a kind of mindful observing, like you'd observe a movie going by, of the thoughts, feelings, sensations that go by, note them, and try not to get fixed on them. And then see if you can clear a space for the humanity of the person, realizing that this is a guy with a personal story and with his own wounds, his own struggles, vulnerabilities. You're filling out the picture of the humanity. Some more and more. Phase 2, we're going to go into the background. This is where each partner takes about 5 minutes, and these times are not absolute, but we'll stick basically to them, where they go into their story, what it was like to grow up. And in particular, how did their family system view the other, whatever the other is in terms of the conversation. In this case, it'll be, how did the family system view problem solving or psychological healing? I think it could be a quite intriguing question for us to explore. And this gives each partner more of a sense of the background of the context out of which they're coming from. Phase 3, taking a stance. This is where they get a chance to describe more fully and mindfully where they're coming from about cognitive behavioral, psychodynamic psychology. Going through these rather quickly so we can get to the dialogue. Fourth phase, identifying, correcting, and admitting stereotypes. I find this exercise fascinating. This comes straight out of Braver Angels' work. Very helpful for each partner to identify, first of all, how they feel people critical of them have stereotyped them. Give their other partner a sense of, a little bit more of a sense of empathy, of where they're coming from, how they felt reduced, what it's been like for them. Then the speaking partner gets a chance to identify false and misleading aspects of the stereotype. Then the speaking partner finally is asked to acknowledge nuggets of truth to the stereotype, because there almost always are some nuggets of truth. And that opens their humanity up more also for possible engagement and connection. And it fills out the nuances of the humanity of both partners. Then the fifth phase is to ask a question, in this case not a policy question, but a question out of genuine curiosity, interest. Really try to come from that place as much as possible toward the other partner. I'm honestly wondering how you see this given that. Something like that. And finally, the discovery results stage. So this is the final phase where we invite the partners to take a breath and reflect on what have they learned, basically, from this process. What have they learned about themselves? What have they learned about each other? And have they found an area for common ground? After filling out the humanity and the nuance of where each other is coming from, is there any place where they connect, and maybe even in an actionable way that they can take beyond session and develop it? And this may be a way that we can move more toward bridge building and a more holistic or integrative perspective in our field. I'd optimally like to see this practiced with with the APA, and perhaps in a big seminar format. We work with people on divides, qualitative, quantitative, standardized perspectives versus multicultural or diverse perspectives. It could be a whole range. Pharmacological, prescribing privileges, perhaps even issues around the military involvement. So this would be quite relevant for our work. In any case, without further ado, I do want to introduce Michael and Paul, and I'm going to get rid of these slides at this point. so we can see each other's faces and bodies a little more clearly. And thank you again, gentlemen. Much appreciated. So I would like us to begin, first of all, with the visualization exercise. That is the first phase. So if you could both just take a few moments, I'll be timing this, to, again, visualize what it might be like to be in conversation with you. What are the thoughts, feelings, associations that come up for you? See if you can just observe those as a stream rather than fixing on them. And then see if you can find some room for the humanity. Okay, so we'll begin now. And please, audience, attempt to embody this yourself. Okay. I'd like you to just take a few moments, if you haven't already, to picture the humanity of each other beyond your initial reactions, beyond the labels. Take a few moments for that. Okay, Michael and Paul, if we could just take a moment to catch your breath, pause as we make a transition into second phase, which is the background phase. So now I'd like each of you, and we'll begin with Michael, to convey to partner what it was like to grow up in the context of this dialogue. Just a few highlights that you feel may be relevant for all to hear, Michael. And then to talk about how your family viewed, psychological healing, problem solving. Thank you. Michael, we can't hear you.
No, there should be that microphone to the left, Michael.
Sure.
How about now?
Now
Yes.
it's fine. Yeah.
Good.
Okay. All right. Sorry, I don't know. I wasn't muted, so it just magically came on. So I grew up I'm the first generation in my family to be born in the U.S. My parents were both immigrants from Europe. They're both Holocaust survivors. They were children when they left Europe, but they each had some pretty horrific experiences. They both would have said that all they wanted to do was to assimilate and be American, and they didn't want to talk about their past experiences and how things like that affected them. So from time to time we'd hear a story, but it would always be in a very sort of removed way. They both really craved order and organization in their own way, and so there wasn't a lot of conflict between them. Or if there was, it was behind closed doors. So there was very little modeling of conflict or aggression in my family, and actually very little problem solving. We didn't really talk about our feelings. They didn't talk about their feelings, and as kids, I have a brother. We fought like brothers fight, but it wasn't until our adulthood that we developed a relationship in which we could really interact. So that was, I think, the kind of model that I grew up with.
Thank you, Michael. And Paul, could you give Michael a sense of what it was like for you to grow up and how your family system approached psychological issues, healing, therapy?
Sure. So I'm the oldest of five children. Parents were from Massachusetts, southern Massachusetts. My father is from a Welsh, French background. He was the first in his family to attend college. Father was a butcher. My mother, Portuguese, Irish parents. They were fishermen and bridge builders. No formal education other than high school. Growing up, I kind of bounced around. I think I attended, I forget now, 10, 12 different schools before graduating from high school, just because my father changed jobs a lot. They were Catholic, Roman Catholic. We were raised Catholic, even though would define myself as agnostic at this point in time. Very conservative. My parents were Republicans up until the latter part of their life. Traditional family. My father was rarely at home. Traveled a lot for work. My mother ran the household, and my recollection was pretty supportive until my father got home on Friday night, and then she told him everything we had done during the week, and we all ran for cover. In terms of problems, in how my family viewed psychology, I think there was a total what would you call it? Lack of appreciation for that. You were just supposed to get on with life, work hard, be successful. My father climbed the corporate ladder all his life. When he retired, he was the CEO of Blue Cross and Blue Shield of New Hampshire, which led to some very interesting conversations between myself and him over the years. But in terms of psychological things, no one talked about things. And I think there was grave concern when I decided to study psychology in college and then to become a psychologist, because no one in my family thought that was actually a viable profession to go into. And I think as a result of my my training, I'd like to think that that's helped me and my siblings. I have a younger brother and 3 younger sisters to develop closer relationships. Though there's still an avoidance of discussing anything very uncomfortable in terms of our personal lives.
Okay, thank you both. Let's go on to phase 3. I'm sorry, phase 3, which is to describe your perspective as mindfully and heartfully as possible. Where is it that you really resonate with your particular cognitive behavioral stance, Paul, psychodynamic, psychoanalytic stance, Michael? And what is it that you'd like each other to understand essentially about your perspectives? So why don't we start with Paul, conveying your approach to Michael?
Yeah, and just I think it might be useful, Kirk, if everyone understood. We haven't rehearsed this or done any preparation for this, so we decided it'd be much better to do this on a spontaneous basis. So I'm representing, and I actually practice some things differently in my in my clinical practice, but I'm representing the cognitive behavior point of view, which is principally what I do, the form of treatment I use in my practice, and I work principally with adolescents and adults, and mostly men. And I've chosen to practice cognitive behavior, CBT, because it's a form of treatment has been shown to be effective in dealing with a wide range of psychological issues: depression, anxiety, substance use, eating disorders, PTSD, relationship problems, family problems, and severe mental illnesses. CBT always appealed to me because it's evidence-based and has been shown to improve the quality of people's lives and functioning, and has been demonstrated scientifically to be more effective, or at least as effective, if not more effective, than other forms of psychotherapy and medications. As we heard from Steve Hayes this morning, there's a large body of research and scientific evidence to support CBT methods and practices. CBT it's based on several basic principles, which I find extremely logical and appealing. I mean, first, the basis is that psychological problems are based on faulty and unhelpful ways of thinking about ourselves, about the world, and about the future. Second, psychological problems are based on learned patterns of behavior, things we learn over the course of our life by direct experience or observing others. And third, that individuals who are having psychological difficulties can learn better ways of coping with them and relieve symptoms and difficulties, making their lives more effective. The techniques or strategies that CBT uses to change maladaptive thinking is to recognize that cognitive distortions or irrational thought processes are at the heart of problematic emotions and behaviors, and that by teaching our clients to evaluate them in a rational and logical way will help them to be more adaptive. They'll develop more adaptive thinking and improve the quality of their life. CBT also involves gaining a better understanding of the behavior and motivation of others using these same approaches and techniques. We in CBT we teach our clients to use problem-solving skills and to develop kind of a greater sense of self-efficacy and self-confidence, and to take over their own therapy in a sense. We also the B in CBT refers to modifying behaviors. Sometimes using very behavioral techniques, such as helping people to face their fears and their anxieties. Using exposure-based techniques, using role plays and teaching. I consider myself as much of an instructor and professor in the lives of my clients, to teach them about their brain, their body, their emotions, and then providing them with skills to deal with challenging situations, and also learning about their bodies. I mean, learning to control their breathing, their physiological responses. And by the way, I did in my graduate training, I attended the Chicago Medical School, which had a very, very obviously strong, biopsychophysiological type of approach, which appeals to me, and I try to teach my clients about this as well. Just a few other things. CBT is designed to create a collaborative relationship, with our clients. In fact, we use the word clients and not patients to communicate that partnership, working to develop a relationship. We basically hope that our clients will become their own therapists with the skills and things that we teach them. And I guess the other perhaps major distinction with other forms of therapy is we focus on the here and now and the future. That some information about our clients' background and history is important, but much less so than focusing on what's happening now and providing skills for moving forward.
Thanks very much, Paul. And now, Michael, can you take a few moments to reflect back to Paul as mindfully and heartfully as possible the essence of what you heard from Paul?
Well, Kirk, I'm not sure how to answer the question about the essence of what I heard, but I'll share some of my thoughts. What I was struck by was how similar what Paul does is to what I think I do and what I think a lot of psychoanalysts do. But with sort of different terms and different languages. I found myself trying to translate to find some familiarity with the language, and then whether I had this other thought about whether that means I'm really not psychoanalytic enough or something, because I also teach and talk to people about breath work and how to breathe when they're overwhelmed and panicked and things like that, so that some of the ideas that are being expressed here are very familiar to me, and I would think of as equally psychoanalytic as they are cognitive behavioral. I thought that in some ways the only place where we might even diverge kind of maybe more than in others would be around the importance of the here and now and versus the background. And yet I think because I think for me as a psychoanalyst, I think about how the past affects the present quite a bit.
Michael, I'm sorry. I need to stop you a moment, because this is a chance to make sure that your understanding is as accurate as possible from Paul's point of view. So you're going to get a chance to elaborate on your perspective. But I'm just wondering if you could convey any more, maybe very shortly, a few themes that you feel capture what Paul is saying. And then Paul has a chance to correct any of your perceptions.
Okay, yeah. So I think I just think I'm really struck by how carefully the approach that Paul described is attuned and paying attention to the client, and not at all formulaic. It sounds flexible. It sounds humanistic, because it's focused on the person and what they need and what's going to be most helpful for them. It feels very familiar. I don't know how else to say that other than
that's great.
Yeah,
that's fine.
Yeah.
Paul, do you feel like Michael has sort of grasped or sensed where you're coming from, or do you need to update anything, correct anything?
No, I think that's accurate. I mean, even though in my theoretical orientation, I wouldn't necessarily, use the word humanistic, because it frankly was never part of my vocabulary, in training, in school, among my colleagues. But there definitely is that. I mean, the relationship that I or we CBT therapists attempt to develop with our clients is based on a recognition of their humanity, that they're not a constellation of symptoms and problems to be fixed, but rather individuals, and we need to, adapt and adjust, even using evidence-based, techniques. You can't just mindlessly, like a robot, treat everyone as if they're interchangeable. So yeah, I'm glad that came through, and is one of the concerns I have with the psychoanalytic approach, and if there's an opportunity,
we can get to that later.
Yeah. Oh, okay. Yeah.
Yeah. I'm sorry, but just concerned about our timing here.
Okay.
But good. Okay. Appreciate that. And Michael, can you now elaborate your stance, as mindfully as possible?
Well, I want to start by talking a little bit about how I wound up as a psychoanalyst, because I didn't start as a psychoanalyst. I started as an undergraduate at UC Santa Cruz. The curriculum in psychology was divided between psychoanalysts teaching psychology and social psychologists. And I found both to be extremely interesting, but I found psychoanalysis to be a little rigid, with a lot of concepts and terminology and language that felt quite made up. As Freud's stories were, quite elaborated, and he'd pull out themes like the Oedipal complex and things like that. And I'd read them, and they were interesting, but it felt not terribly applicable to people to me. So when I started graduate school in 1980, the psychoanalytic model was still quite, it was really the model that most people taught, but there were a few people teaching behaviorism, rational emotive therapy in my graduate program, and it appealed to me more than psychoanalysis did. And I was doing a practicum at a behavioral medicine clinic, utilizing these techniques with people with health conditions, chronic pain, headaches, hypertension, that sort of thing. And what I was struggling with were those people who were coming for help, but not following the protocol that we had laid out for them, that involved relaxation training and periods of relaxation exercises between sessions. And my supervisor, who'd also been trained psychoanalytically, had me start reading some psychoanalysis about why people hold on to their symptoms, specifically Wilhelm Reich and character analysis. And then, of course, I was very influenced by a book that I was assigned in graduate school called Psychoanalysis and Behavior Therapy by Paul Wachtel, who's an analyst. And his way of thinking about the challenges that people had in terms of changing and so on. And this gradually over time led me more and more towards a psychoanalytic, psychodynamic model of thinking about people, even though I was working in a substance abuse treatment program in East Oakland and working on an inpatient psychiatric unit. I was drawn towards understanding the difficulty that people were having in changing the things that they were doing that were making their life worse rather than others. But I was not yet really wanting to become a psychoanalyst, because psychoanalysis still in the late 80s and 90s was a very rigid one-person psychology in which the therapist was the expert on the patient and would tell the patient what was wrong with them, using language that I thought was pejorative and pathologizing, and I didn't think that was the way I wanted to go. But gradually psychoanalysis became more what's generally thought of now as more relational, with a greater understanding of the effects of the environment, the effects of trauma, actual trauma, the trauma that happens inside of families, the trauma that happens inside of cultures, and then psychoanalytic ideas about the structure of the mind, about how complicated and hard it is for people to change the way that they think became more appealing, and I started psychoanalytic training in 2005 as a result. And so that's, I think rather than try to characterize the enormous body of literature that's in psychoanalysis, I think that what stands out for me is that people are the way they are for a reason, that they developed a style of relating in the world that was based on their life experiences, and they developed a style of living in the world that worked for them at some point in time, and it has somehow stopped working. So the techniques, the methods, the behaviors that they've engaged in that used to help them no longer do, and now become what we call symptoms, or we could diagnose as a psychopathology from the DSM. But just my experience was that just knowing that was not enough, and that there would be some way to, through the relationship with the therapist or the analyst, to create a safe enough space to allow people to give up the things that they've spent most of their lives learning to do, so as to be safe and feel more secure.
Okay, thank you, Michael. And Paul, can you reflect back basically what you've heard in a nutshell from Michael, very briefly?
Well, I mean, what I heard was not what I anticipated, from someone from a psychoanalytic orientation. What Michael shared about one finding, when he was in school, the psychoanalytic approach kind of dogmatic and pejorative, relationship between doctor-patient, and and not being, number one, not finding that attractive, but then the way he describes, doing analysis now, creating a safe space, for patients, which is what we do in CBT. I get it, conceptualizing his conceptualization of people being a product of their life experiences. I don't think any of us who practice cognitive behavior therapy would disagree with that at all. I mean, we're a product of our, I think we would probably voice it in terms of a product of what we've learned, and that, yes, indeed, it's no longer functional and no longer working, and that the relationship with the therapist is what moves people, creates a safe space for them to move and perhaps explore new approaches. I'm still I'm curious in terms of what techniques and what methods are used to help people replace those problematic behaviors and things. But as Michael indicated when we talked, it sounds like there's more in common than different in terms of these approaches.
Okay, thank you, Michael. Anything very brief to correct or revise what Paul was saying?
Well, yeah, I'll just, I think to answer the question about technique, I think the thing that is, for me, the focus of my work is the transference. And by the transference, what I mean is that I pay very, very close attention to the way the person in the room is engaging with me and how I feel about them. And it's through that discussion of what I'm observing and what I'm feeling in the interaction, fed back to the person in the room, that I think I can sometimes show them things that they're doing that they're not aware of and didn't intend to do. And maybe if they intended to do it, don't necessarily understand their motives. So someone who always makes a joke when they walk in the door, or always comes 2 minutes late, there's something I think to discuss about that, and that's probably the fundamental tool that I use as a psychoanalyst.
Okay, thank you. And you'll both have a chance to ask each other questions, so you can fill that out more. So let's go on to phase 4, which is the stereotypes phase. And well, we could begin with Paul. Paul, how do you feel you've been stereotyped by those critical of you? Briefly.
Yeah, so just, I mean, I didn't put in when we were talking about our background and stuff, but I kind of had an interesting detour in my life before coming to California. And that was having spent 18 years living in Paris, in France. My wife is French, and after we were married in college and after spending some time in the US, we decided to move to Paris, or she decided to move to Paris. And I was given the option of accompanying her or not, which I decided to do. And I was the vice president and dean of the American University of Paris, but also had a private practice in Paris and was a member of a couple of French psychological organizations. All of my colleagues there, for the most part, were psychoanalytically trained, and I learned to have a deep respect for them as therapists. But there were a number of stereotypes that they had about American psychologists. Number one, most felt that psychoanalysis didn't exist anymore in the United States, and that it had been abandoned and replaced by behaviorism and cognitive behaviorism, which most of them thought, and I hope their ideas changed after 18 years of contact with me, that we were very simplistic reductionists who ignored all the decades of evidence and proof that psychological phenomena and personality are a product of and influenced by early childhood experiences, psychosexual development, relationships with parents and attachment issues, the interaction of the conscious and unconscious, which was a source of great debate among us, whether these things actually existed or not, these separations. Dream interpretation, transference, interpretation of transference, and countertransference. And to give them credit, they were open-minded to listening to my explanations about behaviorism, cognitive behavioral techniques, but also the things that I was versed in: neuropsychology, neural networks, the way memory functions, executive functioning, behavioral genetics, things like that. But I do have the impression that many of our psychoanalytic colleagues look upon cognitive behavior therapists as I said, reductionist and simplistic, and miss out on what they would consider the richness of the human mind and the unconscious.
Okay, thank you. Please go on now to describe any false and misleading aspects of those characterizations. Again, very briefly, we have just 2 minutes.
Yeah, and so I do what I learned, in consulting. I actually belonged to a group that was called the International Counseling Service, and we used to meet every 2 weeks to talk about cases and reading groups and whatnot. Is I developed a deep appreciation for the human aspect of the therapy that my psychoanalytic colleagues did. I don't think we ever agreed on language. I remember one of my psychoanalytic colleagues from London, once when I was describing a case I was dealing with, Brenda told me, she said, "Paul, don't you recognize that? That's a perfect example of the penal fecal syndrome." And I told her, I said, "Brenda, with all due respect, I'm going to laugh at that because I don't know what the hell you're talking about and stuff, but it clearly, in your conceptualization of things, that this makes sense." So I think it's healthy to have these dialogues, to talk, to exchange ideas, and to be all honest, I'm representing the cognitive behavior point of view today. But if I really had to be honest about the type of therapy I do, it's more relational therapy. Mm-hmm. It's developing a relationship with the people I work with.
Oh, great. Okay, and for the third part, can you describe or identify any nuggets of truth to the stereotype for Michael?
To the stereotype of cognitive behavior
toward you as being a cognitive behaviorist.
Yeah, I do think we are reductionist, and that the reliance sometimes on evidence-based approaches can deny or leave out the humanity of the individuals and the complexity of the individuals that we're dealing with. I find myself frequently making reference to with my clients about neural networks and programming and cognitive structures and how memory, is formed, degrades, and whatnot. But it doesn't encompass the complexity of the human brain and the human mind, and the reality that they're often experiencing. I still use those things because I think it's easier for people to grasp and make changes in their lives. But I will acknowledge that I think that there's some, and that's probably one of the richest things that I took away from the experience in France, was a deep respect for other approaches, and being less sure of myself. I mean, I think I was a young smartass who thought I knew everything until I was exposed to a bigger world out there.
Thank you. Michael, would you take a moment to describe the ways that you've been stereotyped by those critical of your stance?
I'm not aware of any stereotypes about psychoanalysts. Is that a thing?
Heaven forfend. Okay.
Who knew?
Well,
okay.
Let's see if we can make room for possibility.
I'll just reference the New Yorker and the entire series of cartoons of the last, practically 100 years of psychoanalysts sitting in their chair, stroking their beard, smoking their pipe,
right,
taking notes, and saying, uh-huh. And I just want to be completely clear right now that I don't smoke a pipe. But I do. So those are the sort of caricatures of psychoanalysis. But I think that the stereotypes that are, one of which I have to say up front, which I think is sort of true and not true, is the stereotype about it not being a research-based model. And so it's an N of one, and to dismiss the N of one as not being valid is to privilege the sort of so-called gold standard of research, which has many, many problems. So it's not to say we should throw out the sort of blind comparison studies, but they have their limitations too, as does the N of one. But psychoanalysts take very seriously their work. Now there's different.
Okay, now you're going into the correcting the stereotypes now.
Oh, I don't mean to. Sorry. So I think that's the first stereotype, that there's nothing scientific about psychoanalysis, that it's sort of all made up. But thank you for pointing that out, Kirk.
Yeah.
The other is the sort of that it's unemotional, and that the theories don't hold up, so that there's a sort of dismissal, I think, of the entire model of psychoanalysis because certain theoretical ideas that are attributed to Freud, that are 100 years old, are somehow reflect all of what psychoanalysis is. So it's not, I think, seen as a comprehensive, complex system that has shifted and evolved over time. Yeah, I think those are probably the ones that I sort of think of as most prominent.
Okay. What do you see as false and misleading about those stereotypes?
I think one of the things that's misleading about psychoanalysis is that it's often, there are two parts to psychoanalysis. There's the theorizing and the metaphorization of the human mind. And then there's the treatment component. And of course there's overlap, but they aren't exactly the same. So when I hear Paul's colleague use the term penal fecal, I kind of cringe a little bit because it sounds ridiculous, but it's a term that other psychoanalysts use amongst themselves and can make sense of. So I think that part of the problem is that there's an enormous body of literature in psychoanalysis and different schools. The French school is different from the British school, that's different from the American school, and there's a very, very strong South American school of psychoanalysis. They're different and they use different language. So there's just something about that sort of, it all gets lumped under this umbrella of psychoanalysis as if it's just one thing. And I think that's one of the things that's problematic about it. And also, I think the imagery of the the abstinent and unemotional analyst is also quite false. I think most of the analytic work that I hear about, people are very warm, very deeply engaged with their patients and clients, and care very, very deeply about wanting the best for them.
Thanks. And how about nuggets of truth, stereotypes? Identify any?
For sure, the difficulty in the scientific of demonstrating and developing technique that can be used across disciplines is a completely legitimate critique, and there are very legitimate critiques of some of the ways in which psychoanalysis has and probably is still being practiced in terms of a rigid application and a rejection of. There are still psychoanalysts who think everything comes from inside, and that people, whatever people's reactions are to the external world, to racism, oppression, misogyny, and so on, is about their ego and not really about a realistic reaction to the environment. And I think, that's also a fair appraisal of psychoanalysis, and also one that we grapple with internally.
Okay, so let's move on to the next phase, which is asking a question of each other. Again, do your best to come from a place of honest curiosity, genuine interest. What would you, chance for a few minutes, ask a question of someone representing a very different orientation, at least in theory, from yours? What would you honestly like to know about each other's point of view? So, Michael, maybe you can ask Paul.
Sure. I'll come back to the thing that shifted me towards psychoanalysis, and that is, what do you do when you encounter what I would call resistance, the sort of the inertia-like experience of a person who's been doing things for most of their life and has not been able to make that change?
Well, I probably would again try to initially using a CBT approach. When I've been attempting to help them understand their thought processes about themselves, about the world, to try to understand if there's some type of illogical, irrational, skeptical, negative thought about themselves, about their ability to change. Do they really believe that they can, despite the any protestation that they're trying? But I will acknowledge that I'll use my relationship with them and tell them how, which is not part of any CBT manual that I'm aware of, but tell them how I feel about them, about a relationship. Reflect what I believe that they might be experiencing from an emotional point of view. But yeah, there's again, I use the manualized treatments and stuff up to a point, and then when someone gets stuck, then rely on the relationship and the emotion, my emotions with them, and the effectiveness of I think the quality of our relationship. If I haven't been able to connect with a client, then working through something like that, would be extremely difficult. But if there is a connection and stuff, it's usually the strength of the relationship will allow me to help them to push through those that barrier, or resistance, as you call it.
Any very brief follow-up question, Michael, or is that helpful?
Well, I'll loan you my psychoanalysis manual, but if you let me have your CBT manual, I just find it just so, because it's not like psychoanalysis has a cure for resistance, and I think of resistance as the natural difficulty that people have in changing. And I think that the idea about sort of strategies and how do you know when to make that shift? Because in a way, it's feels like what I want to do early on with clients myself is to be able to sort of provide them with the help they need in the shortest amount, really. But sort of how do you have an idea in your mind about where you find that moment in which you're going to shift from a strategies-based approach to a more relational approach?
No, I think it's a more, I don't want to use the word dynamic thing, but yeah, probably. No, but I will use, I use books, I use manuals, to try to give them skills. And when we get stuck, when that doesn't work and stuff, then I'll shift to a more kind of relational, type of thing. And talk about my frustration sometimes, in trying to assist them, and desire to want them to be able to shift and move. But always with the idea that I guess I've always committed, there's always where there's a will, there's a way, there's always a method, there's always an approach, there's a language, there's a vocabulary that will allow us to kind of break through, and help them to understand that they do have the capacity to change and to develop.
Okay, great. Paul, you have a question for
Yeah,
Michael?
so I do have a question, Michael. This was actually one of the this came up very early on in my stay in Paris. We were talking in a discussion with my psychoanalytic colleagues about repressed memories, and it was when a lot of the research was coming out of the United States about memories and memory formation, and the fluidity and the inaccuracies of memory. And I guess one of the questions I've had about psychoanalysis is that there seems to be a tremendous reliance on early life experiences and how they've influenced someone moving forward. Yet we believe that memory is extremely inaccurate, and that we're constantly recreating memories, based on our current experiences, based on culture, things that are happening around us. And I guess I'm just curious, for psychoanalysts, is there really as much emphasis today on early childhood or experiences, knowing that the memories of those things may not be particularly accurate?
Yeah, well, I think it's been a kind of a psychoanalytic idea all along that memory is not veridical, so that what people remember is not what happened. It's a version of what happened. It's a compilation of what's happened. It's how they've integrated it over time. So I think there's obviously a continuum in which psychoanalytic ideas have entered into a lot of different psychological methods. But if you're really talking to somebody who's a psychoanalyst, I think that, who's sort of really focused and shifted, not just sort of had a training as a psychologist, that were exposed to psychoanalytic ideas, that what you would hear from the psychoanalyst is that I listen to what people's historical experiences are, and I know on some very deep level that they're telling me their truth, presuming that they're not lying, which people can do, but they're telling me their truth as shaped by subsequent life experiences, which can be other people's memories and so on. So it's one of the great challenges, I think, of being a therapist, any therapist, is the struggle between, kind of, do you believe what I'm telling you actually happened? And we hear sometimes terrible and horrific things, but if you got the entire family in the room and they were all talking about it at the same time, each would have a slightly different version of that. That's what Craig Haney taught me about witnesses when I was in social psychology at Santa Cruz. People remember different things and experiences filtered through their psychology. So and all of the rest of their experiences, so that what I listen for is what meaning they're making of it, how they're telling me about their experience. Are they overwhelmed, immersed, distant, removed, laughing, crying, talking a mile a minute, speaking in a dissociated or the person paying attention to how the story is, the experience that they're describing. I don't want to call it a story, but the experience they're describing happened. I don't think about it as a, that they've got a little movie that they're playing back, because I just don't think it worked that way.
Paul, any very brief follow-up to that? Are you
No,
satisfied with that?
I mean, yeah, that helps. I mean, because I think I had the illusion that many psychoanalysts are pretty dogmatic about that. And that probably comes from the reading about the Oedipal complex and early separation from the mother, and some of these Freudian concepts and stuff that sounds like have evolved significantly.
Yeah, but I don't want to say that those concepts that either aren't still in use and also have some utility. I mean, but they're shorthands. They're, saying someone has an Oedipal complex today would be like saying somebody had parents and they have different attachments to different parents, and their template for who they love is based on their early childhood experiences, for better or for worse. And I actually, that's why I think sometimes we're just using the same concepts. We're all dealing with people, right? And human beings aren't really that different, whether they see an analyst or a behaviorist or a CBT therapist. So we're describing what we're seeing in different ways, and we think about how to engage with them in different ways. But yeah, those concepts are still around, but I think there's a different way of thinking about them. To tell someone they have an Oedipal complex doesn't do much for them, even if I could say it's technically true. It's like, okay, you loved your mother, good, good for you.
On that note, why don't we move on to the final phase 6, results discovery. Take a moment just to reflect on what you learned from this experience together, what you learned about yourselves, just as importantly, what you learned about yourself. What you learned about each other. Was there any room for common ground or connection that you might even take forward in your lives? So maybe we can start with Paul first. You have a few minutes.
Sure. So what I would, number one, I appreciate being able to do this, Kirk, and getting to know Michael a little bit better. I mean, we've interacted before at conferences, but at a pretty superficial level. So this was fun on both a personal and professional level. Two, it seems like we have a lot more in common than we've got differences. It's different language, different framework, but for the most part, focused on achieving and doing the same thing with the clients that we work with. And one of the things that I made a note of, I think Michael's description that there are different forms of psychoanalysis, or different. There's the French method, and even in France, there are a dozen different schools of thought, the British, South American. And what makes me realize is that psychoanalysis, I believe, is much more conscious, aware of cultural differences. I think one of the shortcomings of the manualized approach to psychotherapy, the CBT and whatnot, is that we assume that all human beings are more or less alike, programmed the same way, and it does remove. I think there's utility in that, because I do think that most of us are the same, and I do think that there's some methods that are unbelievably effective with all people, but it oftentimes takes away the humanity, takes away the cultural specificity of each individual that we deal with.
Anything? Well, I guess you stated what you feel is in common.
Yes. Yeah.
Okay.
Yeah, and I think there's room for communication rather than being in dogmatic camps and things. I think there's a lot to be learned. I mean, I'm particularly frustrated, in some of the work I've done in Palo Alto University. I'm teaching a course now at the California School of Professional Psychology and Psychopathology, and I mean, there's nothing more frustrating than trying to teach graduate students the diagnostic categories in the DSM-5, without injecting, how ridiculous a tool it is.
Right.
So that definitely there's room for exchange and appreciation and stuff. And I think we can all learn from one another.
Thank you. Michael, your reflection.
I think it just it reaffirmed something that I believe in, and is that we, as human beings, but also specifically as professionals, the downside of putting ourselves into a particular professional community. So I go to a lot of meetings that are filled with psychoanalysts, and we all talk the same language, and we all feel very good about ourselves. And I suspect Paul goes to a lot of meetings with, trainings and conferences where they're talking about CBT. And we think the other person is different than us. And Paul is not very different than me. We approach our clients in very similar ways. We want something best for them, but we don't really know about each other's method. Paul probably more than I, having spent 18 years with French psychoanalysts, which sounds like quite an immersion to me. Certainly much more than I spent as a CBT person, but still there's a tendency to kind of think the other is really different. And that's sort of what I'm most struck by as the more Paul talks, as he went through his list of things describing CBT, I'm thinking, well, that sounds like something I do. That sounds like something I do. So does that mean I'm not a psychoanalyst? I mean, or is Paul really a psychoanalyst in disguise or something like that? And so it just reaffirmed, it reminded me of something to kind of get out of my silo, to use that terminology.
Right. I so appreciate your engagement here, and I think you've given us all a lot to reflect on, and some openings to possible expansion and deepening of our therapeutic schools, so to speak. So I noticed that there has been some questions about how this might be applied with people who are really on very opposed cultural or political sides. One thing that I will mention is I'd be glad to make my slides available to anyone in the audience who would like to think about going through this process with someone. But I do highly recommend that you read the book as well to get the background and the caveats doing that. Well, I think we can open it up. Let's see, we have roughly 5 minutes, I believe.
Yes,
so we can entertain. What's that?
Kirk, there are a couple of questions that I'd be happy to relate.
Okay, I think we can do that very briefly, and then what I'm going to do is invite you all to the Meet the Speaker period, half hour, where the three of us are going to be responding to your fuller questions. Okay, Paul. So
so there are a couple of questions. Stephen asks, how can the process being described by you, Kirk, be applied when it involves beliefs that are not only fantastical but seemingly devoid of supporting evidence, such as QAnon statements and conspiracy theories?
Well, I think there are positions that are so extreme and people who are so extreme that it's very difficult to bring them in to a process like this, even this experiential democracy dialogue format. The people are not likely to engage in it, for one, because it does require some degree of composure and centering of oneself and openness, respect toward the other person. That said, I don't want to rule out anyone in this process. I do think it's possible that people who, let's say, are extremely liberal or extremely conservative can sit with one another and go through the framework and could well be surprised by what they find out in a beneficial way. Finding out more about the human, I mean, people who believe in QAnon are still human beings. People who identify with green, let's say, collectivist position are also human beings. So the question is, are people willing to engage in this? I also think that this is a lot about reaching the critical masses, people within hearing distance. And if we can do that more, we have a chance of marginalizing the very violent, polarized minds, if you will, and also engaging more of those folks.
Okay, and then we have another question from Allison, who asks, are you familiar with the constructs of honor cultures, dignity cultures, base cultures? And if so, how would you recommend incorporating these conceptualizations into softening the polarized mind?
I have some familiarity with some of those. I think it would be very interesting to try out. Again, you have to have two participants willing to work with each of the exercises. I think it would be interesting, as I say, to explore that. And again, these kind of terms can be very incendiary. They suddenly bring out all these associations and make us think, oh, that's impossible. I can't, there's no way that I could possibly even relate to such a person who identifies with genital cutting or something like that. But I can tell you frankly, I've been surprised in these Braver Angels meetings. There have been people who have been pretty divided by the end of the session. And I'm not trying to draw a panacea here, but by the end of the session, there has been just more of a sense of camaraderie or connection, often on things that have nothing to do with the dialogue or the policies necessarily. And that's really a big part of this approach, is helping to set the ground for, or the seedbed for, being able to be more present to each other and enhance the likelihood of achieving common ground from that position. Anyway, I give some anecdotes in the book about how this shifted from liberal conservative to a group of us relating to each other, going to ball games in my hometown of Cleveland when I was a kid. These guys were on completely opposite sides, political sides of the spectrum, with me and with each other. But when we had a chance to find out more about our backgrounds, we had some very interesting connections and real warmth there. These kinds of things happen often enough. Dialogues.
Okay.
So,
and then Suzanne made a comment. She said the role of humor and laughter in the dialogue seemed to help bridge a gap in theories and approaches. And she's asking, do either of you use humor intentionally, consciously, unconsciously in your work? And I'll answer quite quickly. Right. I work with young people, so I'm making bad jokes all the time. So yes.
Agreed. I think I'm really funny. My patients may not agree, but definitely use it. And like Paul, I work with adolescents, and you can't be glum and serious with it. Well, maybe you can, but I like to have fun with my adult clients as well.
Yeah. Well, and I think this is where a more mindful or presence-oriented mode can be really helpful, where you know you are loosened up a little bit and can go with what's in the moment and recognize the humanness yourself and your client. And this is, I often like Irv Yalom's description of contrast between two weary travelers meeting at an inn, psychotherapists, as distinct from two doctors with white coats and black bags. I'm sorry, or a doctor with a white coat and black bag going to give something to the patient, who's very bedraggled and not kind of on the same human plane in a way. So,
okay, so we're at the end of our formal meeting time on the main stage, and Dr. Schneider and Dr. Donner and I are going to be in the Meet the Speaker session to ask more questions. Suzanne had another question, which we don't have time to answer now, but perhaps we can address that, Kirk, in the Meet the Speaker, and that is, how does cultural diversity affect this type of activity? Yeah. How do you incorporate that?
Great question.
So we're going to stop now. Michael and Kirk, we're supposed to click on the phone, just as a reminder, and leave the session and go to the Meet the Speaker section. And then I'm going to, in 20 seconds, I was told, hit the stop broadcast button. So thank you all for joining us.
Look forward to meeting you soon.
Okay. Yeah, so Kirk, you can go ahead and click that phone icon and leave, and I'm going to just wait for a few more seconds before I stop the broadcast.
Okay.